Hello, my name is Craig Poskus. I am presenting Chapter 22, Infectious Diseases Manifesting in the Respiratory System. This is for Professor Dorkowski in Bio 150. So like last chapter, I decided to break down the anatomy of the respiratory tract before I proceeded on through with the diseases and the infections. So starting in the respiratory tract on the lower side, you start at the alveoli. That's going to be in both right and left lungs. The alveoli connects to the bronchioles. Then those connect to the bronchus, and then those connect to the trachea. Then moving towards the upper section, starts with the larynx. The larynx then connects to the epiglottis, then to the pharynx, which is the throat. And from there it moves either to the mouth or up to the nasal cavity, and then obviously through the nose. And so before we get into the diseases, the natural defense for the respiratory tract, our body has three lines of defenses. So the first line of defense is what's known as the anatomical defense. These are physical features, movements, but not chemical imbalances or anything like that. Some examples, and this is going from outside of the body to in order. You got nose hairs, mucus, cilia in the trachea and bronchia, which is going to be the throat, and then you also have movement such as sneezing, coughing, and swallowing, which we do almost involuntarily. Before getting into the second and third defense. Alright, so moving into the second and third line of protection that the respiratory tract has. So if the virus or infection or bacteria, sometimes fungus, but that's very rare, we'll get into that in a couple of slides. But if it was to make it past the anatomical stages of defense for the body's natural system, the lungs would then experience a spike in the number of peptides and cytokines in the alveoli, which is the lowest part of the respiratory system. It's in the lungs. Then the body would produce a group of lymphoid tissues that develop in the tonsils. And inside the tonsils there would be a cluster of the tissues, and inside of that would be they would secrete the IgA. Okay, so starting with the first disease in the respiratory system, I figured I'd start off very basic, and there's nothing more common than the common cold. So the symptoms are sneezing, sore throat, runny nose, congestion. All this typically takes place around in the sinus region, the upper part of the respiratory system. It's generally not accompanied by a fever, but it can. It's very rare circumstances of that were to happen. The biggest danger about this infection is that it can actually set up patients or victims to more severe infections. The common cold can actually be developed by over 200 different types of viruses, and this infection is spread by the droplet contact that is breathed in. Okay, so I figured I would jump into the second most common of the respiratory infections, and that's going to be the sinusitis. Basically, it's inflammation in the sinus region. This is the most common side effect of many different respiratory infections, but can be classified as its own infection or disease. This can be caused by allergies. This is referring to when people, in the springtime, for example, if they go outside and they have a pollen allergy, they would feel pressure on their sinuses. It can cause sinus pain or nasal congestion or pressure or headache, and sometimes even a toothache. Also following with this, the mucus discharge would be a yellow or a green color. So moving a little bit deeper into sinusitis, the most common way for this to be entered into the body is through a virus. That's typically, I think I read it was about 75% of this is going to be through viruses. And then following the 75%, you have bacteria, which is about 23%, which is still a good portion, but not as much. It's most often, if it's a bacteria, it's most often the normal biota. It's a pathogen underlying another infection that'll build up in fluids. And then the last 2% is going to be fungi. But for a fungus to infect someone with sinusitis, it's very rare, but it's usually detected when the patient is given antibiotics and the antibiotics fail to treat the symptoms. So moving on to, I believe, is going to be my third disease, is going to be pharyngitis. And basically what this is, it's inflammation in the pharynx or the throat. This inflammation can cause, obviously, throat pain, but also swelling. And the infection can lead to noticeable packets on the walls of the throat, making swallowing and breathing difficult. It also causes a viral sore throat and can lead to people complaining of having like a hoarse voice. It's just screechy and scratchy. It's the bacterial can cause a more painful experience for the patient, and then if it's a bacterial that has infected the pharynx, it's often accompanied by a fever. Usually can come with headaches and sometimes nausea. Okay, so next is going to be my fourth disease of my PowerPoint, the disease manifesting in the respiratory system. This is the most severe disease that I do in this PowerPoint. It's going to be Streptococcus pyogenes. And what this bacteria is, it's a gram-positive coccus that grows in chains. The substance is an anaerobe substance, and what that basically means is that it's like antioxidant. It also produces a slime layer that it can use as its own personal defense. It has different types of antigens on the surface that can mimic the host proteins. I didn't add it in here, but just a little side note. It can mimic host proteins. The antigens typically protect its being from being affected by the body's natural lysosomes. And this infection, the main reason that this is probably the most deadly one is that it can lead to like scarlet fever and other major diseases. And so before I run out of time, I wanted to do one last disease, and it's a disease that at one point in time everybody's had. It's influenza. It's also known as, in common terms, the flu. The biggest problem about the flu is that if it's left untreated, it can have a serious impact. It can even result in death, depending on different aspects. age, how well the body's being taken care of, different antibodies that's in the system, immune systems, just stuff like that can play a factor in the impact that this disease has. So just some common symptoms for the flu is just going to be chills, coughing, headache, fever, a sinus infection, a scratchy throat, fatigue, and body aches. So the flu and the common cold usually get mixed up, but the more the symptoms are, the more severe the symptoms are, typically you can pick out between the two. And that's going to be the end of my Chapter 22 PowerPoint. If you have any comments or concerns, please let me know. Feel free to shoot me an email. I don't mind to go back in and fix it. Thank you.